Most men start experiencing enlarged prostate between age 40 and 60. In some men it can come sooner than that. In other men it can come a little later than that. And typically the symptoms are going to be getting up at night to urinate, more frequent urination during the day, a weakened stream, difficulty getting the stream started, difficulty emptying the bladder completely. You go to the bathroom, you think you're finished, you go ahead and leave the bathroom, and 2 minutes later, gee, I have to go to the bathroom again, and you realize you hadn't emptied the bladder completely. Well, the prostate is a little gland that, when it's healthy, it's about the size of a walnut, and it encircles the urethra, the urination tube, like a donut. And when the prostate enlarges, it enlarges in all directions. It enlarges outwards, but it also enlarges inwards, and so it starts compressing that urination tube. And so the opening to let the urine out becomes smaller. And at some point that can become small enough that the normal urine pressure that you use to empty the bladder isn't enough to overcome the squeezing down on the tube. What's usually happening is that the body's testosterone is being converted into a waste product called DHT, and there's a specific enzyme in the human body called 5-alpha reductase that accomplishes that. Well, DHT, there can be some benefits to having a certain amount, but if you have too much, which tends to occur as we age, then that plays a role in enlarging the prostate. The other thing that can happen with testosterone as we age is that the body can start turning it into estrogen through an enzyme called aromatase. And while men actually do better if they have a little tiny bit of estrogen, we certainly don't want too much. And so both the estrogen and the DHT can be potentially hard on the prostate. Well, there's a component in Prosalene, a chemical component called onathine B, and that is a 5-alpha reductase blocker, and it's also an aromatase blocker. So we cut way down on the percentage of testosterone that's being converted into these other undesirable products. And when we do that, typically the prostate will then start to shrink down and, for lack of a better term, behave itself. Proper dosing of Prosalene, you start out taking 30 drops twice a day. You can take it straight or put it in liquid if you want. So 30 drops twice a day for 2 weeks, and then you drop back to 15 drops twice a day, and that's your long-term dosage. Most of my patients that come in with symptoms of enlarged prostate and they start on Prosalene, usually takes them approximately 2 weeks for the symptoms to get dramatically better. Sometimes as little as 1 week, sometimes up to 3 weeks, and you can have a few exceptions. You can have the occasional guy that might get better in 3 or 4 days, and you might have the occasional guy that takes a month or so to improve, but usually about 2 weeks. My own personal experience with Prosalene, I had been getting up 4 to 5 times a night to urinate, and as you can imagine, that's a royal pain. And within about 10 days of starting Prosalene, I found that I was getting up once a night or many nights not getting up at all. And that has continued for the many months that I've been taking this product. I couldn't be more thrilled with it. Every man that has prostate issues, Prosalene is always my first choice, my first recommendation.